Hi everyone, I'm Jeremy Henderson Tilak Singh at Indigo Path Collective. Thanks for stopping in to learn a little bit more about the use of turmeric as complementary medicine in the treatment of PTSD, post-traumatic stress disorder. Post-traumatic stress disorder, PTSD, is articulated in the DSM, the Diagnostic and Statistical Manual of Mental Disorders. Um, It's described as first having exposure to death, injury, or sexual violence, which is followed by trauma-related symptoms following exposure, such as avoidance behaviors, changes in thought, mood, arousal, and reactivity. And these symptoms may impair functioning and occur with dissociative symptoms such as depersonalization and derealization. And inherent in the experiences of many diagnosed with PTSD are impairments to fear, extermination, maybe experiencing hyperarousal and issues with executive functioning, verbal and working memory, some learning difficulties. And what is often focused on when we are in treatment is anxiety and depression. Those who experience PTSD are at higher risk for mortality, but also comorbidities. So, Alzheimer's disease, autoimmune disease, traumatic brain injury, cardiovascular disease, type 2 diabetes, irritable bowel syndrome, metabolic syndrome, and obesity. And what's interesting is that within each of these diseases, inflammation is present. And this may, in part, explain or suggest that post-traumatic stress disorder enables a dysregulated immune system inflammation response, and that response may be to harmful stimuli associated with PTSD and in part help to explain this dysregulation. So the science is linking PTSD and inflammation, although we don't have precise understanding of how that happens. The questions remain, does PTSD induce inflammation or does inflammation sustain PTSD? Furthermore, do we have a genetic predisposition to PTSD for some individuals? So for some answers to what may be a bidirectional model, we can look to neuroscience, which is exploring a variety of mechanisms to understand the impact of PTSD. The first here that we're looking at is that individuals certainly can experience post-traumatic stress disorder as an interpretation, a misinterpretation to tolerable situations, and may be interpreting those as threatening when faced with trauma-related stimuli. And this can, potentially suggest fear network dysfunction. When we look at animal studies, we're looking into the amygdala playing a central role in fear learning and memory-based expression and fear extinction. But post-traumatic stress disorder overall may identify or help it be explained by prefrontal cortex, hippocampus, and amygdala dysregulation, and those are associated with inflammation, and we can see this in neuroimaging. Adverse childhood experiences may also help to explain this PTSD and inflammation linkage. As we know, as a result of early life, stress-inducing inflammation can cause changes to our cognitive, neural, and immune systems. They may be adversely affected. So it's conceivable that childhood adversities produce chronic inflammation, resulting in these health concerns out of over a life and providing an environment where PTSD can be sustained. Another model is looking at the HPA and autonomic nervous systems. So a hypoactive HPA axis combined with a hyperactive sympathetic division of the autonomic nervous system is evident in individuals experiencing post-traumatic stress disorder. And this helps explain the HPA axis dysregulation linked to inflammation across numerous post-traumatic stress disorder studies. It's important to note that inflammation suppresses homeostatic control, which can result in dysregulation of the inflammatory response, and the HPA axis is implicated in homeostatic control. There are certain biomarkers that are associated with PTSD. You see them here, IL-6, TNFA, and C-reactive protein. IL-6 and TNFA are pro-inflammatory cytokines, and they're observed across the blood-brain barrier. So they may be implicated in inflammation-causing cognitive impairment. Together with C-reactive proteins, they may cause an environment or create an environment that's capable of sustaining post-traumatic stress disorder. And together, these give us a way, a viewpoint to pharmacological treatment of PTSD, in addition to or in place of trauma counseling for those who may be resistant to psychotherapy. So speaking of pharmacological opportunity to treat PTSD, the FDA has approved two medications, two SSRIs, Zoloft and Paxil, for the treatment of post-traumatic stress disorder, likely targeting anxiety and depression, as we talked about earlier. What's interesting about these two medications is that they both have anti-inflammatory properties. Turmeric is also used to treat inflammation. It's historically used as a medicinal herb, actually, to treat a multitude of diseases in Chinese, Indian, Islamic, traditional, and Ayurvedic medicines. It's a plant that's grown in tropical and subtropical regions, and it's made from the plant's rhizome, in other words, the roots that are growing under the ground, essentially. The plant grows really well in sand or clay. It produces yellowish flowers and reaches a height of 3 to 5 feet. The good news is that turmeric is available over the counter without a prescription. It is not a scheduled drug, and it's generally considered safe as a dietary supplement with few side effects, but we will talk about side effects, potential side effects here in just a moment. The precise mechanisms of action with turmeric are being examined. They're actually unknown at this point, but we do have some ideas that they decrease histamine-induced inflammation, increase cortisol production, improve blood circulation, and importantly, as we just talked about, reduce the C-reactive protein, TNFA, and IL-6 levels. The turmeric is well positioned for human trials, although most experiments with turmeric are in rats and mice modeling. Of course, there's some pros and cons with any type of medications. Turmeric is, the pros here are over-the-counter availability. It's an anti-inflammatory. The side effects are rare. And the cons, as we talked about, are that we don't understand the precise mechanism of action. We could utilize human trials, and dose and quality have to be monitored. Whereas SSRI's pros are that there's a prescription that is required, but that can certainly delay effectiveness. It's FDA approved, and it is an anti-inflammatory, the two approved by the FDA. So cons are time to effectiveness. Side effects can be difficult, like weight gain, and these SSRIs may mask the PTSD symptoms if they're focused on the anxiety and depression symptoms. As I said, there are some side effects with turmeric, such as allergic reactions, digestive issues. There was one instance of liver injury that resolved with discontinuation of use. But importantly, if you are breastfeeding, it can suppress breast milk production. So it brings me to pro tip number one. Psychotherapy is the first indicator for PTSD. So finding a counselor who's trained in treating trauma is critical to the resolution of the PTSD symptoms. Pro tip number two is to give turmeric a shot as a complementary medicine and useful in the reduction of inflammation related to the experiences resulting from post-traumatic stress disorder. Pro tip number three is to always consult with a doctor or a pharmacist. Make sure that any medications you're taking are not interacting with the turmeric. If you'd like to learn more, go ahead and reach out to me, Jeremy, at Indigo Path Collective. I also have a number of references that are listed here for you. Yeah, so here you can check out these references for more information. Additional references are listed here. There's a lot of information out there available, and here are even more references for you. If you'd like to do more reading, check out these references. And here's the final list of references for you. Again, I'm Jeremy at Indigo Path Collective. If you have questions, feel free to get in touch. Thanks for stopping in.